Hi, this is Dr. Raj Singh. I practice here in Las Vegas, Nevada. Today I want to talk to you about hot flashes. Now, having hot flashes is an extremely uncomfortable experience, to say the least. Although we often associate hot flashes with menopause, there can be other reasons for hot flashes, especially if it starts happening at a younger age. Severe emotional stress, certain medications like diltiazem, renal cell cancer, thyroid cancer, and something called as carcinoid. They can all cause hot flashes. Focus of today's video is to discuss menopausal hot flashes. So what is menopause? So no menstrual cycle for 1 year is considered menopause. We also sometimes check a blood test called follicle stimulating hormone, or FSH, and if the levels are more than 30, that's also consistent with a woman having attained menopause. What's a hot flash? So a hot flash is this feeling of intense heat around the chest, the face, and then it spreads to the rest of the body. This may last 5 to 7 minutes and is more common at nighttime, then we call it night sweats. This may disrupt sleep, typically followed by a sensation of extreme cold, like chilling sensation, and then shivering, and the body restores the temperature back to normal and the hot flash goes away. Some of the risk factors for having hot flashes include obesity, African American race. In African American race, it's primarily thought to be because of having a high body mass index, and also African Americans tend to have lower estrogen levels as baseline. Now, most women, they experience hot flashes for average of 3 to 5 years from the onset. Ovaries produce necessary hormones such as estrogen, progesterone, and testosterone till about age 52. And after the ovaries stop working, most women start noticing these hot flashes. Now, the hot flashes may appear at an early age, if a woman had one ovary removed, or both ovaries removed surgically. History of chemotherapy can also be suggestive of poor overall health, especially of the adrenal glands. Now, ovaries produce about 50% of the estrogen, progesterone, and testosterone, and adrenals produce the rest of the hormones. So experiencing hot flashes at a younger age or having really bad hot flashes can be a sign of underlying adrenal problems. Maybe the adrenal glands are not as healthy, and that's why so many hot flashes. Now, in this picture, you can see that menopause is associated with low levels of estrogen, low levels of testosterone, a lot of erratic fluctuations in the level of estrogen and progesterone. The vaginal walls become thinner over time. All these hormonal and physiological changes, they result in mood swings, hot flashes, night sweats, decreased sex drive, irregular menstrual cycle, vaginal dryness, and also painful intercourse. Some of the other symptoms along with hot flashes may also include issues with sleep, feeling of crawling ants under the skin, which is called formication, irritability, and fatigue. Women also crave a lot of snacks, and there can be a weight gain, especially around the belly area. Now, women also are at higher risk of getting urinary tract infections, urinary incontinence, and inflammation of the vagina, along with hot flashes. Let's look at the physiology. So our hypothalamus regulates our body temperature. Now, this can be disrupted when we have estrogen withdrawal. That leads to increase in body temperature. Body causes vasodilation, which is dilation of blood vessels, which causes sudden cooling of our body. And because there is increased blood flow to the skin, we feel that hot feeling, and then there is a sudden drop in the body temperature as that heat dissipates. Now, some of the causes of hot flashes include imbalance between estrogen, progesterone, and testosterone. In the past, we thought it was always from lack of estrogen. However, by itself, estrogen deficiency is rarely a cause of hot flashes. Testosterone deficiency can lead to it, hyperthyroidism. Certain medication, like I mentioned before, diltiazem is a common one. Now, coming to the treatment for hot flashes, well, clothing is so important. So always dress in layers, so it's easy to take them off, running a fan close to where you are, maintaining a good humidity level in the house. It's kind of hard to do that with central air conditioning, especially in a place like Las Vegas, where I'm from. So I love having an evaporative cooler in my house. Evaporative are great for environment. They add a good amount of moisture in the air. They reduce the level of pollutants in our homes. So a good buy overall. Other things we can do is lose weight to decrease the conversion of hormones. In our fat, we have an enzyme called aromatase, which can convert testosterone to estrogen. So by the process of weight loss, we have eliminated that source of that enzyme, and that can certainly help hot flashes a lot. Avoiding alcohol. Alcohol dilates blood vessels, so it may worsen the symptoms of hot flashes. Avoiding other stimulants, smoking, coffee, those are the big ones. Let's look at supplements. So vitamin E and turmeric. So a recent randomized controlled trial, actually published this year, it showed that there was a significant improvement in hot flashes by using a combination of vitamin E and curcumin, which is a supplement that comes from turmeric. However, it took 8 weeks for improvement in symptoms. Now, most women I know who are suffering from hot flashes would not wait 8 weeks before they feel better. So you may have to add other medications. Other supplement is black cohosh. Some studies showed significant improvement. However, other studies showed absolutely no benefit. So in my book, that's an unreliable supplement. Let's look at wild yam. Now, wild yam is often advertised as a plant-based phytoestrogen. This is not something I recommend, as multiple reports of having synthetic progesterone inside the wild yam product. So don't use it. If a woman has high estrogen level issues or estrogen imbalance, avoiding foods that have a lot of high estrogen, like soybeans. When it comes to prescriptions, there are certain antidepressants like paroxetine, venlafaxine, fluoxetine or Prozac that can improve the symptoms of hot flashes and menopause. I rarely prescribe antidepressants for this because so many side effects. Other prescription medications called gabapentin. It may also reduce the symptom of hot flashes. Works well actually. Clonidine is a blood pressure medication that also can help certain individuals. I do not prescribe clonidine for hot flashes. It causes a lot of sleepiness, especially during the daytime, and also patients feel like their mouth is always dry, so they don't tolerate it well. Now, last but not the least, bioidentical hormone replacement therapy. Now, balancing the hormone is about balancing the imbalance between estrogen, progesterone, and testosterone, right? So rather than having just a true deficiency of estrogen, so we don't really have to give women estrogen for hot flashes. I typically use combination creams of bioidentical hormones. A lot of our patients also like getting hormone pellets, which provide a steady dose of bioidentical hormones for up to 5 months. If you don't know about pellets, I did a video a while back on testosterone pellets, so same concept. Please go ahead and watch it. Now, hot flashes are extremely uncomfortable. And what I've seen is that a combination of changes in lifestyle, along with some supplements, sometimes prescription medications, and hormone replacement therapy, when indicated, result in the best outcomes. I hope you like the content for today's video. Please do not forget to like and subscribe. If you disagree with something, or if I missed out something that is great for hot flashes, please leave a comment so I can research it further. Thank you again for joining me here today, and I will see you back in a few days. Bye-bye.